Okay, so what I'm going to talk about for the next 40 minutes or so are shelter metrics. And I hope I can give you some ideas about how you can use the data that you collect to help you better run your shelter, how to judge whether you're meeting your goals, and as you look at the data, hopefully how you can better set other goals that the data might suggest. So before you all get up and run away, because I know from experience with the veterinary students that people go numbers and their eyes get big and they glass over and everybody goes to sleep. So I'm hoping to keep you awake enough so that I can encourage you to really think about using the data that you collect to a greater extent than I think many of you already are. So there are lots of uses for data. And I suspicion that all of you who are collecting it use your data in some way. You can use it for your intake and outcome numbers. Oftentimes you're making reports to your board of directors. You're reporting your numbers to the public. You may be increasingly, grant funding agencies are asking for your numbers. What's the outcome of what we've given you the money now? What impact has that money had? And then a lot of times you're using it to help find an animal. Somebody comes in or calls in and says, I've lost my brindle-shaped boxer cross dog, and you go into the computer to see, in fact, if you've got a dog like that that matches that inventory. People returning their animals, if they have an unsuccessful adoption, you don't want to log them in as a new animal, but go back and pull up the animal's record that you had before when you adopted it and then put it in. But what I'd like to do today is try to suggest perhaps some ways that you're not using the data. And I know that some of you are. I mean, I've visited shelters here, and I know that some of you are doing some of the things that I'm going to suggest today. And this is by no means a comprehensive list of things. My whole intention today is to try to encourage you to think about using your data more extensively. The reason I asked you about whether you had a computerized program or whether you collected data and to get an idea of how many staff you're using to input data is to illustrate to all of you that you're using a lot of staff resources. You're putting a lot of time and effort into collecting that data. Why not use it? It doesn't make sense just to collect data for its own sake. You need to be using it to the greatest extent that you can. So, as I said, that my goals are to actually encourage you, and then I want you to share that information broadly with your staff. Your staff ought to know. Everybody in the shelter should know, how's the shelter doing? Because it's a means to celebrate your successes. It's a means to motivate people to do a better job. You know, if 1 out of 3 cats walking through the door develops upper respiratory, then the staff needs to look hard and long at what can we do to bring that rate down. That's too many cats getting sick in our care. Okay? And so think of the metric as in your toolbox. You've got a lot of other tools that you use every day. Those metrics ought to be another tool to help you better manage your data. So we often really get caught up, and we're as guilty as anybody, of looking at this individual animal or the problem with it, or I'm really focused because I work with the animals in the kennel and I'm focused on the kennel. But this is to kind of get you to think broadly about the whole schema of all the things that are going on. Think about, you've got intake, you've got most of your animals are usually coming in as owner relinquishments or strays, and I know there's probably a mixture of you in the audience, so I know that there's some of you maybe in a rescue group or whatever, but bear with me. A lot of this will also pertain to some of the rescue groups and how you could use your data to better manage your animals there. So you've got animals coming in, and basically we want to reduce those owner relinquishments and strays coming in, right? We have animals in the shelter, and I'm going to come back to this in a minute, but we also have animals moving out of the shelter, hopefully alive. We're trying to minimize the number that we actually euthanize in our shelters. And within the shelter itself, there's a moving system. Animals come in, they're maybe held for a little while before they have their veterinary exam. They're vaccinated. They have to, if they're not already neutered, they have to go through a neutering process. And then we have to house them. We have to think about, do we have enough cages to be able to accommodate all of these animals? Of course, we have to feed them and what have you as well. But each of these areas has a goal, or many goals actually, associated with them. So, but in very broad terms, we want to reduce intake over time. We want to provide for the very best welfare for the animals in our shelter. If we allow 1 out of 3 cats to get sick in our shelter, and there are ways that we can minimize that, then we're not doing the humane thing. Those cats that come in that get upper respiratory suffer. And we're humane organizations. So we've got to do everything we can to try to minimize that suffering and enhance the welfare of our animals in our shelters. And then thirdly, we want to release as many as possible alive and put them into loving homes. So if we look at this again, I want to concentrate for a moment on some of the metrics that we might look at to help us judge whether or not we're making progress towards diminishing the intake of our animals. And so one very common strategy is our spay-neuter programs, right? We're spay-neutering not only to benefit each individual animal, but I dare say that our the most primary reason that we're spay and neutering is hoping that we can reduce the number of animals in the community such that we see a decline in intake. So how do you know if it's working? How do you know whether you're making progress towards diminishing the number of animals walking into your shelter? Well, one way, and probably the way that most of you are looking, is to actually look at intake. So this happens to be a shelter that has data way back to 1992, which is really great, but you don't need it to go back that far. Just start monitoring. Even if you don't monitor now, go back and start looking at what was your intake last year? What was your intake the year before that? And one thing you can do is just look at how, is it changing? Well, like so many of our shelters in the Northeast, and this is not staying on, we aren't making much progress with cats. I mean, cats seem to be everywhere, despite neutering and all of our other efforts. Fortunately, in this shelter, they are making progress with dogs, and that's very common in many of our northeastern shelters. If you went down into the southeast, you'd find that, in fact, they still have a very live and well puppy problem as well. But another way that you might think about, well, if I'm doing a really effective job with my spay-neuter program in the community, then I ought to see fewer puppies and kittens coming in every year. Now, obviously, there's a delay between spay-neuter and actually seeing an effect. And in fact, with the dogs, it's taken literally years, if not decades, to really bring that down. But I think you need to start looking at least, is it going up? What is the actual level of, and this is the proportion. So in this shelter in 2008, looking at kittens, there were roughly 49% of the kittens, of the cats that came in were kittens. Obviously, again, in the Northeast, we do a better job with our puppies, so very many fewer puppies. Not much progress, though. It's not changing much. You wouldn't really expect it to change in 3 years, but if we went back even further, this hasn't changed for a long time. Here's one where you start looking at the data for puppies, and now there are normal variations. And so it's not really clear yet whether this is a normal variation with the puppies, or in fact, are we getting a higher proportion of puppies coming in now in 2010? And is that reason to worry? Is that reason to say, uh-oh, what's going on here? We'll be following this into 2011 to see whether, in fact, that kind of levels off or drops off, or whether, in fact, we have a trend here, which is something the shelter needs to respond to. Here's looking at, you'd also expect if your spay-neuter was working, and I'm looking at cats here, though, is that over time, the proportion of cats coming in that are intact should go down. If you're reaching in the community enough of the people who have cats that are reproducing, we ought to be looking to see whether or not, in fact, we're seeing a declining rate of cats coming in that are intact. And in fact, in this shelter, either overall or among their surrenders or strays, there's not much change. Another use for these kind of data would be to say, you know, how does it vary among the different kinds of groups? But you can pose new questions. Well, how could I reduce this? What could I do? Who are we missing? Why aren't we making any progress? This is one that's a little bit more complicated, but we're beginning now to use some of the newer technology. This happens to be for the GIS technology, where you can code by coordinates of addresses where in fact things are coming from, and then plot them. And here in Tompkins County, we have identified these are foci of kittens coming in every year. And what we're going to do is now target those areas for our spay-neuter, so that we're not just doing spay-neuter for anybody that happens to agree to have it done, but rather going out proactively to look for those areas and work in those areas where our kittens are coming from. So that's an idea for you, to look a little bit more carefully at your intake. And I've just scratched the surface on the number of things that you could really start to look at. Let's take and look at the animal shelter, because this is really just a survey kind of to encourage you to think. So we want to provide for this is our second goal. We want to provide for the very best welfare for our animals while they're in the shelter. And one of the things that goes into welfare, of course, is illness. There are other things as well, of course, enrichment for behavior and all, but let's talk about one, and that's illness. Well, these guys are suffering. These guys are suffering. Now, I've obviously picked out some of the worst, but the point is, you've all seen some of these guys, and even the ones that are not quite so severely affected, they don't feel well. And if we can prevent that, isn't that what we're all about? We're a humane organization. So what can we do? Well, what kinds of things contribute to illness? Well, there are lots of things that contribute to illness. Sanitation, obviously, things like lack of vaccination. But I want to talk about two. One is increasing lengths of stay in the shelter, and the other one is overcrowding. We know now from several studies that the longer a dog or cat, but particularly cats, are in our care, the more likely they are to develop an upper respiratory tract infection. And the way that you read this particular slide is that if a cat stays in the shelter 5 days, it has about a 12% risk of developing an upper respiratory tract infection. If it stays 10 days, that jumps up to about 55% risk of getting URI. If we keep our cats 15 days, they're well over 80% likely to develop an upper respiratory tract infection. And this has also been shown for the kennel cough complex in puppies. The longer, and it makes sense if you stop and think about it. I mean, because what happens is the longer they're there, the more likely they are to get exposed in some way, either by fomites that we are carrying around, or by contamination, or breakdowns in our sanitation. And so anything we can do to decrease that length of stay will decrease the risk of upper respiratory infection. So here's a shelter that went no-kill, hence this is median length of stay. Median is just like, think of it as an average, okay? It's the middlemost value of a group of values. And here's a shelter that went no-kill around 2001. And for a while, obviously, when you go no-kill, probably you're going to increase your length of stay. But it began to get away from them over time, and in fact, the length of stay increased considerably. Now, you should be able to monitor your length of stay. What is your average length of stay? This doesn't cover exactly the same period, but it's the same shelter, and they've been continuing to work on dropping their length of stay. And as their length of stay has dropped, and this is just in 2010-11, but it's continuing to drop, look what's happening to the URI rates in this shelter. Now, in June, we had only 6% of our cats develop upper respiratory tract infections. That's pretty remarkable. And I'm not saying that that's the only thing that's going on here, but I honestly believe that length of stay was one of the predominant reasons that we have been able to drop the URI rate. The other thing, you can use it, where are their bottlenecks? I mean, we talked about the fact that these cats or dogs go through the shelter. There's a whole system going through the shelter. They have to be vaccinated. They have to get in the queue for the spay-neuter. They have to get onto the adoption floor. Well, if you've got a really long length of stay, where are the bottlenecks? Is it because they have to wait for spay-neuter? Is there anything? Now, sometimes there are things you can't do, like you've got a stray hold, and you know you have to hold them for at least 5 days if they're strays. But there are things like spay-neuter, perhaps, that you could do to expedite or to get a veterinarian in twice a week instead of just once a week. But what it is it prompts you to think. You need to go into problem-solving mode. What in my shelter can I do to reduce the length of stay? Here's another one just to remind me to say that sometimes you want to break it up by age group because we expect our different age groups to stay different lengths of stay. So obviously our unweaned cats, if you've got a huge proportion of unweaned cats, that's going to drive up your average length of stay. So you may want to separate it out and take out the unweaned cats and look at your juvenile and your adult cats as a separate group. So you can get more creative and more refined in your use of the data as you get into using it more. Now let's talk a little bit about overcrowding, because this is one of the other big contributors to illness and the risk of our animals getting sick. And there are lots of reasons why overcrowding can happen, right? I mean, for those of you who have cruelty investigation, you could get a huge seizure in. You don't have much control over that. I mean, that's going to walk through the door, and you're doing your job, and that you're just going to have to deal with trying to get those animals through your system. Obviously, there are seasonal fluctuations. We all know about the kitten season and what happens to our populations during the kitten season. But it's also true that, sometimes we try to save everybody as they present themselves. And there are some strategies that, you can say to somebody, we're full right now. We're full. We are at capacity. Can you hang on to this animal for the next couple of weeks while we move animals out of the system? So you don't have to be immediately responsive to everybody. Now, if they say, I'm going to dump the cat out the door if you don't take it today, obviously then your hands are tied and you're going to take that animal. But you can work with people to let them know that you're full and you don't want to go over that because you can make animals sick, including the one that they're going to bring in. And then something I call intake creep. I just want to run through this little exercise. I'll do it fairly quickly, but it's easy just for animals to start coming in and you sort of lose track as to what is actually happening in your shelter in terms of capacity. So let's just say we have a new shelter and we've got 55 cat cages in it. 20 animals enter that first day when we open up. Obviously, it's a very artificial, but I'm trying to do it in a really short way, just to illustrate a point, okay? All right, so 10 of them leave during that. You're able to get them adopted safely out of the shelter. And so you still have 10 in the shelter, right? Because you started with 20, take away 10. All right, so you start off with 10 in the month of May, and now 30 more enter. So now you got 40 in the shelter, right? But you're still okay because you got 55 cages and you can still manage these animals very well. And now you have 15 leave. And you've done better because you got 5 more adopted, right? But now you got 25 in the shelter. And similarly, they're there, then 40 enter. Pretty soon you got 65 in the shelter. 25 leave. You're doing better with your adoptions, but now you got 40 left and in the shelter at the end of June. Similarly, you start with now 35. You've knocked those entering down a little bit. You've increased the ones leaving, but now you've got 75 animals in the shelter. And now 25 leave. Do you get the point? The point is it's very easy, and usually this happens over a longer period of time, right? I mean, I made this very, very short. But it's not hard to begin to exceed your capacity to care for these animals. 2 things happen, or many things can happen. But one is you've got overcrowding now. We know overcrowding leads to more disease. Secondly, you probably haven't increased your staff. So now your staff has less time per animal to take care of those animals. What do? They cut corners. I clean a little faster because you still got to open at 11 or 12, whatever your opening time is, right? Okay. So what we would really like you to do is know your length of stay and also to look at your capacity. Now, I think most of you think about capacity in the terms of how many physical places do I have to put an animal, right? I mean, that's what comes to mind. That's certainly what comes to my mind. But don't forget that it also has to do with staff. That if they can only afford to give each animal 5 minutes a day, are they really doing quality care? And that includes cleaning, feeding, changing all of the things that you have to do with an animal. But let's talk a little bit, since I can't talk about all of them, let's talk a little bit about physical capacity for a moment. So the easy way to determine that is to figure out how many cages you have, how many spaces you have. You'll have to make some estimates with colony housing, but I encourage you to err on the lower side of colony housing than on the higher side. Any of you have watched some of these cats. They may look like they're getting along, but the poor cats that are sitting on the top shelf who don't move because they're afraid of the bully Johnny down at the bottom, their welfare is suffering. You put more cats in there, the more likelihood they are to have animals that are not doing well in that situation. So you really have to watch them. But also including any kind of permanent offsite that you might have at PetSmart Charity or whatever, as well as your foster care network. Because your foster care network helps you when you need them to increase your capacity. But that's once you have that number, that's the number above which, if you get beyond that, you are above capacity, and you are obviously there are different degrees of overcrowding, but you're now overcrowding, and you're increasing risk of disease and poor welfare. Okay, so here's a shelter that does pretty well. So the red line is their capacity. Here's a shelter that for many years was doing very well up until about the time they got to be May. Well, what happens in May? The kittens all come in. That's right. And in fact, at times, they got up to around 400 and some animals, not only in the shelter, but in their foster care situation. So they were giving foster care providers multiple litters, and the litters were getting mixed and more likely to get disease when you start mixing litters. Way too many animals in the shelter. So we've been working with that shelter to try to diminish that. And of course, we're going to be watching this, but we're hoping that through various strategies that we can continue this trend in 2011, where we can hopefully stay below the red line, but if not, then be considerably closer to that line than they have been in previous years. So what happens when you exceed your capacity? Well, guess what? Your length of stay goes up, because now you've got all these animals, and people come in, they're overwhelmed, presumably your outflow doesn't necessarily increase dramatically, not in relation, just like that creep that we were talking about a few minutes ago. We talked about the fact that the average time per animal goes down. What do you do when the next animal comes in? What do you do? What do you do? You get a portable cage, right? So you get a portable cage. So you get one, that's fine. Then there's 2. Then there are 5, then there are 10, and now you're way over capacity. Yeah, you can say those are additional cages, but they aren't cleaned as easily, your staff can't take care of them, that's overcrowding. Okay, this is just a plot to kind of satisfy us that as median length of stay goes up, or as the average daily census goes up, so does the median length of stay. Not surprising. So what can you do to increase capacity? Well, you could say, well, I could build a bigger shelter. Well, one, that's not practical. Secondly, what happens? I mean, if this one's already gotten full, what happens? You fill up the next one, right, with the same creep that we talked about a minute ago. You haven't really solved the problem. You've just now delayed it a little bit. So here's some things to think about. We talked already about delaying intake, having people hang on to that animal a little bit longer while you move some other animals out before bringing it in. Of course, always working to do outflow, but all of those off-site adoptions, other making arrangements to have other places like PetSmart, whatever, so that you can bring Agway. We use Agway here in Tompkins County, where we have some other places that we can place animals and get them out in front of the public that wants to adopt these animals. And then we can do things to decrease that length of stay, as we've already talked about. The only thing that I want to, and incidentally, illness increases your length of stay, right? It's a vicious cycle. More illness, increase of length of stay. More illness, increase of length of stay. So there's other things. We also talk about fast tracking. I don't have a lot of time to talk about that because I'm going to run out of time. But what I want to mention is that you can. It's okay if you've got really highly adoptable animals. I know we always say, well, we don't want, we want to make sure that the other ones that have been there a while are showcased. But remember, you can do that through other means. But fast track some of those. Get your babies out of there. First of all, they're going to get sick. They're more likely to get sick in there. Get them out of there as quickly as you can. I'm not saying ignore your other animals, but I'm saying it's okay to fast track some animals, as well as paying attention to some of those and highlighting some of those that have been in your shelter for a long time. So this is a really busy slide, but I want to point out to you something. So here, I'm just going to start off with one cage. Now, I know none of you have one cage, but I want to illustrate the point that if the average length of stay is 30, obviously, or the length of stay is 30 days, you can only house one cat in the month of June, right? But if I have that length of stay and make it 15 instead of 30, so I can get them out of there in 15 days, lo and behold, I can handle 2 cats in that same cage, in that same time frame. So I've doubled my capacity to handle animals, right? Similarly, now, if I can drop that to only 10 days and move them out in 10 instead of 30, I can take care of 3 cats in that same cage. Let's just fast forward now. I've got 10 cages. Now, I can do 10 times 1 or 10, I'm sorry, this thing is not working well. Can you see that I can, you can see that by reducing your length of stay, just by reducing your length of stay, you can increase the capacity. You can put more animals through, and you can reduce your disease risk at the same time. And we don't have time today, that's another discussion, but there are a lot of strategies that you can use to help reduce your length of stay. We've already talked about one of them, looking for the bottlenecks, problem solving. Where can we intervene to make it shorter? And this will be in your notes, but you can use a little formula here to help you figure out. And you can figure out the number of cats that you can house in a particular period. That could be a month, for example, by using your average length of stay and the number of cages. But if you do a little math, this is the only math I'm going to talk about. If you do a little math, you can solve for other things in the equation. So if you already know the number of cats you have in your house and you want to know, am I over capacity, and you could calculate the percent that you're over capacity. I'm 10% over capacity. I'm 50% over capacity by using this formula. So it'll be in your notes. And I encourage you to think about it. It's not really hard. And this, just to summarize, this is what happens. If length of stay increases, and intake exceeds outflow, then animals accumulate, blah, blah, blah. We've already talked about that. Okay? So I've already talked about that. And just one last couple of comments on outflow. And the big name of the game is we really want to get these animals out of here alive, right? But how many of you use the live release rate to help yourselves monitor how you're doing in the shelter? So you could certainly use the adoption rate. You could certainly use the transfer rate. You could use your return to owner rates. But many of you, at least using PetPoint, you automatically get the live release rate according to the Asilomar Accords. And I just want to point out to you that one of the problems with this definition, and what it is it says, how many animals have I successfully been able to get out of the shelter? By that I mean they're still alive. Out of all of those, including euthanasias. So it's kind of 1 minus the euthanasia rate. Okay? The only problem with this rate that I don't like about it is that it excludes, I do like about the fact that it does remove owner-requested euthanasias and animals that are dead on arrival. That's appropriate. But it also includes animals that die or are lost. So you could open up the door, let half of your animals out, and they wouldn't be reflected at all in this particular live release rate. So I just want to pass that along to you. That said, among those that you're able to have an outcome for, you now have some estimate of how well you're doing. And I think it has real value. The problem that it has is that if we go back to our estimate, or our little graph here, it doesn't include the fact that you could be accumulating animals like crazy. That it doesn't capture the fact that now you may be getting into a hoarding situation as a shelter because now you've got way too many animals. That's not reflected in that live release rate because it only looks at animals that have already had an outcome. So, and it doesn't include if they start dying because you're overcrowding, they don't get captured there. You don't get penalized for that. That may be great for your donors, for you trying to solicit money from your donors, but it doesn't give you a very fair estimate of how you're doing in the shelter, okay? And these are going to be here for you just to consider. These are a couple of other ways, kind of the worst case and the best case scenario of live release rate. But what I'd like to say is probably the very best thing that you should be doing is use Asilomar, use that approach, but also look at your length of stay and look at how you're doing in terms of capacity. Because you need all of those to give you a better sense of how you're doing in the shelter. Okay? So again, there's lots of uses for data. Just one other quick question. All of the data that I used here, with the exception of the GIS, you guys could do. These data are all available in PetPoint. We use PetPoint predominantly, but even if you're collecting it by hand, these are not hard data to get. Okay, so it's not like, she's standing up there talking about all this, but how would we ever do this? And the other comment I want to make is, guess what, guys? You do have the resources to do the Excel, okay? Because if you don't know how to use Excel, your kids do. I go to my son. I go say, hey, how can I make it do this? Okay, and Excel is very, very common, so it's not an excuse for you guys not to do it. I don't have the technologist, I don't have an IT person, blah, blah, blah. Yeah, you do. Yeah, you do. I absolutely agree. So I just want to, my basic point is to you to think about using that data. You spend a lot of resources, and it can help you better manage your shelter. So that's all I have.